Chronic nonspecific low back pain, or CNLBP, is a widespread health issue that affects millions globally. It's especially common in adults aged 40 to 69, and women are slightly more likely to experience it. Unlike back pain caused by a specific injury or disease, CNLBP is defined by pain lasting more than 12 weeks without a clear underlying cause. This condition can significantly impact daily life, making even simple movements challenging. In this video, we'll explore how the lumbar paraspinal muscles play a role in CNLBP and why understanding their function and structure is key to effective treatment. Let's begin by looking at what makes these muscles so important for spinal health. Lumbar paraspinal muscles, including the multifidus and erector spinae, are essential for stabilizing the lower spine. They help maintain posture, support movement, and protect the spine from injury. When these muscles are weak or dysfunctional, the risk of developing chronic low back pain increases. Many factors such as age, sex, and body composition can influence the health of these muscles. Recent research has focused on how these muscles change in people with CNLBP and whether exercise can reverse any negative effects. Understanding these muscles is the first step toward better management of chronic back pain. Researchers use advanced imaging techniques like quantitative MRI to study the structure and composition of the lumbar paraspinal muscles. These scans can reveal details such as fat content and muscle volume, which are important indicators of muscle health. By comparing these measurements in people with and without chronic low back pain, scientists hope to identify patterns that could guide treatment. However, previous studies have shown mixed results, and the relationship between muscle structure and function remains complex. This study aimed to clarify these connections and see how exercise might influence them. Research was conducted in two main parts. First, a cross-sectional comparison was made between 43 patients with CNLBP and 43 healthy volunteers matched by age, sex, and body mass index. All participants underwent MRI scans and functional tests to assess muscle strength and endurance. In the second part, 29 CNLBP patients participated in an 18-week hybrid home-based exercise program, with 27 completing the full course. The study aimed to see how exercise affected both muscle function and structure, as well as pain and disability levels. Participants included adults aged 18 to 70. Healthy volunteers had no history of chronic low back pain, while CNLBP patients had pain lasting more than 12 weeks, localized to the lumbar region. Strict criteria ensured that other causes of back pain, such as spinal surgery or nerve root problems, were excluded. This careful selection helped the researchers focus on nonspecific low back pain and its relationship with muscle health. Both groups underwent detailed clinical assessments and MRI scans as part of the study protocol. To evaluate muscle health, researchers measured several key parameters. Fat fraction (FF) indicated how much fat was present in the muscle, while total muscle volume (TMV) and functional muscle volume (FMV) reflected the size and quality of the muscle tissue. Functional tests included maximal isometric lumbar extensor muscle strength (MILEMS) and lumbar extensor muscle endurance (LE). These tests provided a comprehensive picture of both the structure and function of the lumbar paraspinal muscles in all participants. Exercise program for CNLBP patients lasted 18 weeks and combined daily home-based routines with regular physiotherapy checkups. Exercises focused on back school principles, respiratory training, and sensory motor control to activate deep trunk muscles and reduce overuse of superficial back muscles. The program was progressive, with increasing difficulty and regular monitoring via mobile app or paper diary. This hybrid approach aimed to improve adherence and maximize the benefits of exercise for muscle function and pain relief. At the start of the study, CNLBP patients had significantly lower muscle strength and endurance compared to healthy volunteers. The MILEMS to LPM-FMV ratio, which reflects muscle quality, was also lower in the patient group. Interestingly, there were no significant differences in MRI-based muscle parameters like fat fraction or muscle volume between the two groups. This suggests that muscle dysfunction in CNLBP may occur before visible structural changes appear on MRI scans. The study found only modest correlations between muscle function and MRI-based structural parameters. For example, higher fat fraction was linked to lower muscle strength and endurance, but these relationships were not strong. Muscle volume was positively associated with strength, but again, the explained variance was low. This indicates that while MRI can provide useful information, it may not fully capture the functional status of the lumbar paraspinal muscles, especially in patients with mild clinical impairment. After 18 weeks of guided home-based exercise, CNLBP patients showed significant improvements in muscle strength and endurance. The MILEMS to LPM-FMV ratio also increased, indicating better muscle quality. These functional gains were accompanied by reductions in pain and disability scores. However, MRI parameters such as fat fraction and muscle volume did not change significantly after the exercise program. This suggests that functional improvements can occur even without visible structural changes on MRI. Following the exercise intervention, CNLBP patients' muscle strength and quality were similar to those of healthy volunteers. Endurance was still slightly lower, but the gap had narrowed considerably. Despite these improvements, pain and disability scores remained higher in the patient group compared to healthy controls. This highlights that while exercise can restore much of the muscle function, other factors may continue to influence the overall experience of chronic low back pain. Muscle quality refers to the ability of muscle tissue to generate force relative to its size. Factors such as muscle fiber type, architecture, metabolism, and fat infiltration all play a role. In this study, the improvement in the MILEMS to LPM FMV ratio after exercise suggests that muscle quality can be enhanced through targeted training, even if muscle size does not change. This finding emphasizes the importance of focusing on functional outcomes in rehabilitation, rather than relying solely on imaging. Though MRI is a powerful tool for visualizing muscle structure, it may not fully reflect changes in muscle function, especially in patients with mild symptoms. The study found no significant differences in MRI parameters between CNLBP patients and healthy volunteers, nor before and after exercise. This suggests that functional improvements can occur through neuromuscular reactivation and better muscle coordination, which may not be visible on standard MRI scan. Study's exercise program used a hybrid model, combining home-based routines with professional oversight and telemonitoring. This approach allowed for individualized care, better patient engagement, and improved adherence. Hybrid rehabilitation models are becoming more popular, especially with advances in telehealth technology. They offer flexibility and can be tailored to each patient's needs, making them a promising option for managing chronic low back pain. Sensory motor control exercises focus on activating deep trunk muscles, like the multifidus, while reducing overuse of superficial muscles. These exercises help improve muscle coordination and quality, leading to better spinal stability and less pain. In this study, such exercises were a key part of the intervention and contributed to the observed improvements in muscle function. They are recommended for patients with chronic low back pain as part of a comprehensive rehabilitation program. While the study provides valuable insights, it also has some limitations. The sample size was relatively small, and most patients had mild symptoms, which may limit the generalizability of the findings. The follow-up period was 18 weeks, which might not be long enough to detect structural muscle changes. Additionally, the lack of a control group for the exercise intervention means that causal conclusions should be drawn with caution. Future research with larger, more diverse samples and longer follow-up is needed. Findings suggest that functional testing of the lumbar paraspinal muscles is more informative than MRI for assessing muscle health in patients with mild CNLBP. Exercise therapy, especially programs that include sensory motor control, can significantly improve muscle function and reduce pain and disability. Clinicians should consider incorporating functional assessments and individualized exercise programs into their management strategies for chronic low back pain. Better understand the relationship between muscle structure and function, future studies should use multimodal MRI protocols, including diffusion-weighted imaging and MR elastography. Longer-term studies with larger and more diverse patient populations are needed to determine whether structural changes in muscle can be achieved with different types or durations of exercise. Controlled trials will also help clarify the causal effects of exercise interventions on muscle health and clinical outcomes. In summary, this study shows that patients with chronic nonspecific low back pain have significant dysfunction and reduced quality in their lumbar paraspinal muscles. Exercise therapy can almost completely restore muscle function and quality to the level of healthy individuals, even if MRI scans do not show structural changes. Functional improvements are closely linked to better pain and disability outcomes, highlighting the importance of active rehabilitation in managing chronic low back pain. People living with chronic low back pain, these findings are encouraging. They show that with the right exercise program and support, it's possible to regain muscle function and improve quality of life. Hybrid rehabilitation models and sensory motor control exercises offer practical, effective tools for managing symptoms. Remember, improvement is possible, and taking an active role in your rehabilitation can make a real difference. Journey to better back health involves understanding the role of the lumbar paraspinal muscles, using functional assessments, and embracing exercise-based rehabilitation. While MRI can provide useful information, it's the improvements in strength, endurance, and quality of life that matter most. As research continues, new technologies and approaches will further enhance our ability to treat chronic low back pain. Stay informed, stay active, and work with your healthcare team to find the best path forward.